Hey everybody, Chad Stemler again from Live Well Chiropractic in Wexford, and welcome back. If you didn't check out my intro video from yesterday, go ahead and check that out. We'll give you a little bit of background on what ART is and answer maybe some questions you have about it before we get into some of the stuff that we actually treat with it. So today we're going to be talking about back injuries and neck injuries and things like that, and what we do and how we treat those. So, you know, as a chiropractor, the majority of cases and patients that come in to see us are going to have either back pain, neck pain, shoulder blade pain, something like that. And chiropractic is really good at helping a lot of those people feel better very quickly. So most of the time there's going to be some postural distortions, or, you know, bones and joints that are stuck and not moving well, and getting things adjusted are going to help tremendously. However, there are times when you need something a little bit more, and that's where ART and active release comes into play. So again, one of the reasons that I got into ART was I had been in practice for several years and seen a lot of people with a lot of issues and helped out a lot of people, but there were always, you know, a handful of cases where people just didn't respond. And you hear this all the time: oh, chiropractic didn't help me, this and that. So this is, again, something that can be added on to treatment to help, you know, just try to, you know, get things moving that much better. So again, sometimes with chiropractic we can do other modalities: muscle stim, traction, intersegmental traction, ultrasound, again, to try to treat some of the soft tissue. But this is a way that we can kind of get in there manually. You can actually feel around and see what muscles and what tissues are not moving the way that they should. So specifically in the lower back, there are a number of usual players as far as muscle groups that tend to be tight on a lot of people. And we see people that are in acute pain, so people that throw their back out, or a lot of people that just have more chronic issues. So they maybe sit for work all day, every day, you know, 8 hours a day, 5 days a week, 52 weeks a year. And, you know, maybe they don't have the best chair or the best posture as they sit, or they're working on a computer and they kind of hunch over, and that can cause muscles and joints and things to be out of whack, so to speak, or be unbalanced. And that's, you know, one of the things that can cause what we call mechanical low back pain. So when I'm kind of examining somebody, we're a lot of times, you know, we're checking the joints to see how things are moving there, but I'm also palpating through the muscles, through the soft tissue a lot, and to see, you know, does this muscle feel tighter on one side versus the other? How does it move relative to other muscles around it? And does it just feel tight or stuck? And a lot of times it'll be tender to touch. So if you got a spot, you know, in your shoulders or in your back that, you know, when you get that pain and you push on it and it hurts, chances are it's going to be one of those muscles that's tight. And what we want to do is get that thing moving better. So when I say tight, I like to describe it as, we call it adhesions, we call it scar tissue, we call it a muscle knot. But when those muscle fibers do not slide well, they tend to get stuck together. And again, this can happen from an acute injury, a slip, a fall, you jam your back or pull your back, or it can happen slowly over time. And so I like to think of it as little bits of microscopic bubble gum in those muscle fibers. So as that muscle is moving back and forth, there's an area along there that just doesn't move like the rest of the muscle. And over time, it tends to get tight. And as it gets tight, it gets stiff. And as it gets stiff, it gets sore. And as it gets sore, it can get achy. And if it stays achy long enough and it goes into a spasm, it can become kind of that sharp, knife-like stabbing pain that you get. And if it's still bad enough, then it'll actually go into a full-blown spasm where, you know, you get hunched over, or your neck kind of gets stuck to your shoulder. And so obviously the sooner that we see somebody, the easier it is to resolve those. I just had a guy in today that was all hunched over and muscles were a full-blown spasm through his low back and his hips and his hip flexor. And, you know, we can get him better in one visit, but he's not going to be walking. You know, typically there's still going to be some sort of a hitch there or a limp or something like that, because it does take time for those muscles to, once they reach that state, they don't like to relax right away. So general low back pain is something that we see a lot. And again, there are usually a few common players as far as the muscle groups, what we call the erector spinae group. The quadratus lumborum is another muscle that gets tight and is usually involved in a lot of lower back pain. The psoas muscle, or the hip flexor muscle, is one that can really cause you, when that thing goes into spasm, it can cause you to bend forward and not be able to get up straight. And that one is not a fun one to treat, but it usually responds very well to ART. Again, I'd like to show you some of this on an actual person, but we'll have to, again, figure that out at a later date. Another one that we see a lot and we get a lot of questions about is sciatica. So sciatica is kind of a two-part soft tissue treatment. There's usually muscle involvement, but there's also, since the sciatica is a nerve, there's usually some nerve involvement as well. And when we treat nerve, we're actually treating the entrapment of the nerve. And as the sciatic nerve runs down the back of your leg, it's running through different muscles. And if those muscles get tight, it can actually put pressure or surround or entrap that nerve. So as you try to move, that nerve is getting kind of pulled on, and that can certainly cause those symptoms. So sciatic symptoms classically are going to be kind of that toothache type feel, either kind of in your butt cheek or down the back of your leg. And again, it responds typically very well to both chiropractic and to ART. I've had patients that have been told that, once, if you get sciatica, it's going to take 12 months to go away, or 6 months or 12 months or whatever it was. And that's just, absolutely not true. If it is really sciatica and we can kind of diagnose where that nerve and muscle, where they're tight, where that nerve is entrapped, we can usually help people within a few visits. So weeks compared to, months. So that's, something that we see a lot, get a lot of questions about. Same thing, people get kind of the pinched nerve up in the shoulder, up in the neck. Well, that's not really what's going on. You get a lot of muscle tightness, a lot of muscle spasm, muscle cramps in through the back of the shoulder blade, along the top of the shoulder, up into the neck. Especially if you're sitting, doing a lot of sitting, computer work, we tend to hunch and round the shoulders forward. So we can work on a lot of the rhomboids, again, the erector group up there, what we call the levator scapula. Talk about the rotator cuffs here in the next video, but that's, can be part of that as well. Again, can get some pretty good results fairly quickly. And again, I just had a patient in today or the other day with, slept on her arm fuddy, and all of a sudden getting a lot of this pain and discomfort in the back of the shoulder blade going up through the neck. Can certainly cause headaches, neck pain, neck tightness, stiffness. We see a lot of people for headaches as well. So again, adjustments are usually very good at helping with headaches, but sometimes they can just be recurring. So either the adjustment isn't holding well or something like that. And there's usually, again, a couple of players, a couple of muscles up in the upper neck that come off the skull that can stay chronically tight due to forward head posture, or the way that you sleep, or the way that you work, and we can get in there and release those muscles. A lot of times they're tender and you don't really know it. You may have pain or you may have headaches, but unless you're kind of poking in the right spot, once you find them, they're like, oh yeah, that's, that hurts a lot. So that's, one of the spots that we go after. Let's see, as far as other spine and neck things, so jaw pain. I get a lot of questions about this, and this is usually an after the fact. I don't get too many people that come in specifically for jaw pain or TMJ, but it's as we get other things feeling better, it's like, hey, I got a question. What do you do for jaw pain? It's like, well, let's talk about it. Let's see what's going on. So one of the other things with doing ART is, I ask a lot of questions, just like any provider, we want to find out what's going on. So getting a good history of the problem can help us, diagnose and treat it better. So, let's have a conversation about what's going on with the jaw. Does it pop? Does it click? Does it hurt? Do you grind at night? Do you wear a mouth guard? Have you had recent dental work? So a lot of those things come into play with how we're going to treat that. But again, we can be fairly effective most of the time if there isn't major other jaw issues going on. But people get TMJ headaches, or they get a lot of popping and clicking that might be painful, and sometimes we don't get rid of the popping and the clicking, but at least the pain, we can reduce the pain. There might be some imbalance in some of the muscles there, so we can take a look at that. If anyone has any specific questions, you can message us through Facebook. I'd be happy to answer. I also want to mention that I'm going to be having a special offer to anybody that's interested that watches the videos. We're going to offer a free 15-minute consultation with me, either in person, via phone, or we could probably even do over Zoom to answer specific questions. It's easier if you're here in front of me. We can actually, if I could put my hands on it, my fingers on it, we could see, whether or not you'd be a good candidate for active release treatment for your specific problem. So if anyone is interested, please reach out. You can, again, message us through Facebook. We'd be happy to get you set up. And again, we try to get you in here sooner rather than later. It's not something that, we're going to, give you a free consultation, but we're not going to book you out for 3 months. So we'll get you in here sooner rather than later and see if we can help you out. So thanks for following along again. Look for my video tomorrow we'll talk about upper extremity stuff, shoulder, elbow, wrist problems that I see a lot, and how we deal with that. But again, thanks for watching, and give us a follow on Facebook, or send us your questions in your comments. I'd love to hear 'em. Thanks. Bye.